The Philippines confirms its first case of the Lambda COVID-19 variant, which is reportedly more transmissible and more resistant to vaccines than the original strain. The virus was detected in a 35-year-old female. Authorities have yet to determine whether she is a local or a returning overseas Filipino. The health department says she has already recovered after undergoing the 10-day isolation period. Contact tracing is underway. The World Health Organization classifies the Lambda variant as a variant of interest. The Philippine Genome Center called it an emerging public health risk last month after being detected in Peru, which so far has the highest COVID-19 death rate in the world. But the U.S. Centers for Disease Control and Prevention recently said the variant did not appear to be causing more COVID-19 transmissibility or resistance to the vaccines. The Philippines also detected 182 more Delta variant infections, 112 of which are local cases. All in all, the country has recorded more than 800 Delta variant cases.
The detection of more COVID variant carriers in the Philippines comes as the country struggles to contain rising infections. The health department logged 14,749 new coronavirus cases Sunday, the second highest daily tally since the pandemic began. It was also the first time fresh infections hit over 12,000 for 5 straight days. Metro Manila, as well as regions 4A and 3, reported the most number of infections for the day. Active cases have now climbed to 102,748, the highest since April 23rd. 270 people also died, pushing the death toll to 30,340. Intensive care units across the Philippines now at high risk. In Metro Manila, ICU beds are 71% occupied, according to the latest report of the Octa Research Group. That's the highest ICU utilization rate recorded in the capital region since May 5. Meanwhile, some hospitals in the regions get to breathe a little easier following a decrease in COVID-19 patients.
Mula po kasi nung mga siguro third week of July, unti-unti na po siyang bumaba yung cases namin, no? So up to now. Sa mga private hospital po, konti lang din ho yung mga naka-admit.
I think bumaba kasi from alert level 4, naging alert level 3 na kami last Friday.
The country's largest COVID-19 referral center, the Philippine General Hospital, will temporarily stop accepting non-COVID patients. PGH spokesperson Dr. Jonas Del Rosario says they will only accommodate life-threatening emergencies such as heart attacks, massive stroke, or trauma. All of its outpatient services will also be closed starting today until further notice. This as the PGH tends to 262 COVID patients, exceeding its 250-bed capacity. Meanwhile, Del Rosario notes a majority of their pediatric COVID patients have recovered, including the severe and critical cases. The hospital still has 8 child COVID patients, with 4 more waiting to be admitted.
Medical frontliners urge not to push through with their planned mass resignation. The Philippine Nurses Association is asking health workers to reconsider the possible move amid the growing number of COVID infections in the country. But the group also called on government to listen to the plea of their fellow frontliners. Health workers have expressed frustration over the government's failure to provide the benefits stated under the Bayanihan II law. Data from the Private Hospitals Association of the Philippines shows around 40% of nurses from private hospitals have resigned since the start of the COVID-19 pandemic last year.
Napakalaking bagay po kasi nung salitang malasakit at pagpapahalaga sa ating mga health workers. We sympathize with them. Mababa ang sweldo, no? Walang mga security of tenure, na yung posisyon na inaalok natin ay walang security of tenure. So ang gusto ng ating mga nurses siguraduhin yung kanilang buhay na pag tinanggap nila yung trabaho, protektado sila at magkakaroon sila ng magandang buhay dito.